Welcome to NUR 2010 PN to RN Transitions. This course is really designed to help you mentally bridge the gap between the practical nurse and the registered nurse practice in your everyday life. We're going to start off by focusing on change and change processes to help you really kind of embrace everything that's going on in class and home and work, and get you mentally prepared to take this giant step forward in your life and embrace all of the chaos and the planned change that are simultaneously occurring to help you reach your goals. Your book is the Cherry and Jacob Contemporary Nursing Issues, Trends, and Management, 7th edition by Elsevier. There are online companion tools for the student, so you can register for those. This course focuses on the learning outcomes that are published in your outcomes. Those are listed on OneNote for you. Column 1 in your learning outcomes tells you the content subject that we're covering in that outcome. Column 3 tells you the information that you'll be tested on. So when you are building your own study guide, or you're focusing your reading or your studying or your study groups, or talking to your tutor, what you want to be sure is, can you answer the questions in column 3? So out of everything, column 3 is the most important column out of those learning outcomes. And then column 4 lists the reading assignment for your book. It also includes some other links and supplemental learning tools that are not included in the exams. So back to your book. Throughout each chapter of your book, there are case studies that are woven in. They help illustrate the concepts that you're covering in that unit or chapter. You'll notice that there's vocabulary in each chapter as well, but you really want to focus on the vocabulary from the learning outcomes that are posted in each unit, and not just the vocabulary in the text. You won't be tested on the vocabulary from the textbook. You'll be tested on the vocabulary and outcomes from your learning outcomes. We will cover the information in class. Obviously, I'm going to cover the information in these recorded lectures. We're going to have lots of great group discussions in class, and our exam is going to focus mostly on the information in the PowerPoints and what we talk about in class. And I would consider the book to be kind of reinforcement or supplemental reading that reinforces what it is that we're covering in class. But don't feel like you have to memorize the stuff in the book that does not also get covered in the PowerPoints or outcomes, and that we don't directly discuss in class. So essentially, there's going to be information in your book that's not on your outcomes that you don't need to learn. So this is what the outcomes look like. They're posted in OneNote for you. So again, this is basically the outline of the content that we cover. So this is your content. And in column 2, these are what we call our conceptual threads. So this is just the conceptual threads that we use throughout our program, and so they're listed with our unit objectives to demonstrate how we meet our program overall objectives. This is the most important piece. Again, this is column 3. And so your outcomes are things like define change. And so you want to know the definition of change. Describe the factors that motivate change. And so you want to know what are things that help improve or motivate change. And then you want to be able to identify and compare the different types of change. So that those would be planned and unplanned. So if you notice, if you see here, number 3 says identify and compare the different types of change. If you come back over here to number 3, the different types of change are planned, which includes linear change, and unplanned, which is nonlinear change. So you can compare and contrast planned or linear and nonlinear change. And then there's theories that go along with those. So Lewin's is a planned change theory, and the chaos theory is an unplanned change theory. So you can see how the content out of column 1 directly links to the outcomes in column 3. Now in column 4, this is nice, but the only thing that's required up here is 1, your reading. And then in this first unit, we're going to watch this video, Who Moved My Cheese, together in class. And then the rest of it is just, these are kind of additional things. So these are all kind of enhancements or supplemental things that you could read for additional information. You're not tested on the information in any of these additional articles. They're really more for, again, supplemental or additional learning. I know how busy you are, so I fully do not expect that you're going to spend hours upon hours reading all of these articles. But if you're looking through and there's one that really sparks your interest, go ahead and open it up and look at it. Also, the other thing that's nice about these is they're hyperlinked, but you can look them up directly in the Hartness library, and it helps you learn how to search for things in the library. So that's the other thing that's kind of nice about the listing of the articles there. So let's go through our learning outcomes for this unit. The first one is to define change, and change really is defined as the transition or passage from one state, place, stage, or subject to another. So this can include role changes, which changes your view of self, which is what you're currently doing in your transition from PN to the RN role. And it can also include, the changing of location, the financial change, a status change, change in your marital status, your home life, having a baby, growing up, losing somebody. So change can mean a lot of things. It can also mean just a change in policy at work or change in leadership. So sometimes change is very planned. It's something that we really work towards, and other times change just, is a surprise, and it happens to us or for us, and we have to decide, is that something that, we can live with? Is it something we can roll with, or is it something that we're going to fight against and rebut? And if we fight against change, one of the things that's important to recognize is there's a significant stress that comes with trying to resist change. It's a very complicated process. There's not really a linear process that exists in a vacuum. So even with a linear change process, there's a lot of chaotic side change going on. And even with chaotic change, there's some planned or purposeful linear stuff happening in the middle. So you as a student nurse, you're trying to change one aspect of your life, so going to nursing school, at the same time that you're trying to manage the other constants. So all of your other roles, whether it's work, parenting, your relationships in life, your friendships, any of your romantic relationships, your peer relationships, all of that. And that's a very complex juggle, right? So at some point in time, you're going to feel like, hey, I'm this little person here, and no, I can't draw, so this is like my little ghost figure, and I have all these balls in the air. And it gets overwhelming at some point in time when you add in school, and you add in work, and you add in your kids, and you add in your peers, and eventually you say like, oh my goodness, how many of these balls can I possibly have in the air at the same time before I drop something? And the answer for me is like 2, because I can't juggle. But really, the more support you have and the more you embrace change, the easier it is to juggle all of these things. So what are some factors that can motivate change? This is probably one of my favorite equations, and this is one of the change theories that exists out there. And this says basically, in order for you to overcome resistance, which is R, There has to be a dissatisfaction with the present status quo. So people have to recognize that there's something that they're unhappy with. So all of you recognized that you were dissatisfied with your current status as a PN. And it doesn't mean that you don't like being a PN. It just means that you wanted something more for yourself. So you said, this isn't enough, I want something else. And you had a vision of a positive future. You said, I'm going to go back to school. I want to become an RN. So you have that vision in your head of what a future could look like. And then you took those positive steps in the path. So those first steps, F stands for first steps. So your dissatisfaction times your vision times your first steps. That momentum was great enough to overcome that resistance that's in place in order to create change. And it's absolutely true, because all of you have overcome some great resistance, whether it is time, finance, family, distance, fear, whatever it is. There's never enough time, there's never enough money, it's never like exactly the right time to go back to school. But the DVF has outweighed the R for you right now, and you have said, now's the right time for me, and I'm going to go back to school. So both positive and negative influences and events can encourage or even force a transition. So sometimes students come and they say, I'm going back to school because my employer is getting rid of the PN position and we all have to transition to the RN. So that's a negative influence that has forced a transition because that student wasn't necessarily personally ready to go back to school. Sometimes there are positive influences where somebody says, my employer, I've wanted to go back to school for a long time and my employer just started providing tuition reimbursement, so I'm super excited. Sometimes somebody loses a job and so they go back to school to change careers, or sometimes parents wait until their children have grown up and they are either about to go to college or they're going to college, they've left the house, and the parent decides now is the right time for me to go to school because my kids are old enough that they can tolerate me being back in school, or they're young enough, either way. So you have these positive and negative influences on you that can encourage or force a transition. Take, for example, maybe a mom who's been a stay-at-home mom who suddenly finds herself a single mom and now needs a wage to support her family. That might be a mom that goes back to college, right? Maybe goes into nursing if that's what she wants to do. Same for a dad. Maybe you've got a dad who was not the breadwinner or whatever, and suddenly finds himself being a single dad and wants to go back to school to provide a better life for his family. So those factors, both those positive and negative influences, can include crisis, conflict, disappointment, lack of rewards in your current job. So those would kind of be like the negatives, or a desire for autonomy, self-improvement, improving your finances. So those negative and positive influences can be present. Think about for just a second, what factors motivated you to take this program? And do you think that they were negative or positive at the time that they occurred? Because they're going to have a positive impact on your life either way. But was the underlying or the kind of initial momentum spurred by something that you saw as negative or positive? And I just want you to identify that, because if you are identifying the initial momentum as being negative, you may still be harboring some negative feelings or thoughts. And what I really want you to do is now focus on the positive outcome. I want you to focus on the long game. So it's not focusing on getting through this semester. It's not focusing on getting through the end of next semester. It's not focusing on graduation. It's not focusing on your boards. It's not even focusing on getting an RN job. What I want you to focus on is becoming the best nurse that you can be and having the best life that you can possibly have, and really thinking about that long game, because it's not about your first exam and it's not about your first day of clinical. It's about all of those years to come when you're going to be working in this awesome job as a nurse providing for your family, giving back to the community, doing what you love day in and day out. Okay, so even if it was a negative force that maybe started this change, it is going to give you this amazing positive impact at the end. And so I really want you to focus on the long game, because when you look long term, it really helps make change a little bit easier. So there are different types of change. And for the purpose of our outcomes, we're going to talk about planned change as being very linear, following a path. And we're going to think about Lewin's change model. And then unplanned change, which is nonlinear and can also be referred to as chaos or chaotic, and the butterfly effect. So this is an example of a picture representation of Lewin's change model. The change theory has three major concepts: that they're driving forces, restraining forces, and equilibrium. Driving forces are those that kind of push in a direction that causes change to occur, and they facilitate change because they push the person in a desired direction. They cause a shift in the equilibrium towards change. Restraining forces, then, are those that kind of counter the driving forces and hinder change. So they push basically in the opposite direction. And some people are driving forces and some people are restraining forces, but oftentimes internally we also have both driving and restraining forces. And some of those even could just be eagerness for change and fear of change at the same time. So equilibrium is the state basically where both the driving forces equal the restraining forces and no change can occur. So as we looked at that first model, you really have to have enough momentum to overcome resistance in order to enact change. So there are these three stages of change. And the first stage is unfreezing. So unfreezing is the process of finding a method of making it possible for people to let go of the old pattern that was counterproductive. And it's necessary to overcome kind of your individual and the group restraints and that conformity to whatever it is that you're trying to change. So if you're trying to change the documentation method, or if you're trying to change, the way that people do wound care or whatever, you have to think about what it is, why it is that they are somehow emotionally connected to it. So there are three methods basically that we use to achieve unfreezing. So first is to increase the driving forces that direct behavior away from the status quo. So that would be to try to get like buy-in on the new product, or have some sort of a emotional connection to the new product. So you want to have them see that it works and have them become, eager and a proponent for that product. The second is to decrease the restraining forces that negatively affect the movement. So trying to eliminate or decrease resistance. So kind of whittling them down, or even just, having good discussions to make them more aware of their resistance. And then the last would be kind of combining the two. So improving buy-in and decreasing resistance at the same time. So that's unfreezing. So unfreezing is getting people ready to change. It's basically, getting buy-in. The change then is the actual step where the change occurs. And this is moving from the current practice to the new practice, or from the old to the new. And you can change thoughts, feelings, behaviors, or all three. In the refreezing phase, the change has occurred and it now has become a habit. So it's becoming frozen or basically solidified in the practice or the beliefs of the people. So without refreezing, it's easy for people to go back to the prior state. And in order for you to move from the unfrozen, like where you unfreeze the person, convince them that change needs to occur, enact the change, and refreeze them in the changed state, it requires enough repetition and buy-in that they will continue this new habit. And if you take, for example, a person who wants to quit smoking, let's say, in order to unfreeze them from the habit, there has to be internal motivation. There may be external motivation, but they have to see it as something that they actually want to achieve. They have to have, evidence and belief that this is something that they can achieve. Then they're going to go through a process where they're trying to quit smoking. And during that change process, they're going to have a lot of desire to go back to their old habits. They say, it takes a minimum of 21 days of not smoking for the cravings to even start to, dissipate. So it takes like 21 days at a minimum to create new habits. And then refreezing. And we know that refreezing really anchors that change. So people will consider themselves like, kind of smoke free or whatever after a certain period of time. But we know that there will always be the ability to fall back on old habits. It's the same things with drug and alcohol. That's the refreezing part that probably is the greatest challenge for us, making sure that they stay with these new habits and in this new state. For you, you're also experiencing planned change, and that is in the sector of personal growth. Patricia Benner has some information, or she has a theory that she talks about calling the novice to expert theory. That is in your textbook on page 421. And we all start out as a novice every time we're new, and it's okay to let yourself be a novice. I think one of the hardest things for you coming in as a practical nurse, especially if you're an experienced practical nurse, is being new again. And it's so hard to not be experienced, and it's so hard to not be in control, and it's so hard to not know everything, and it's so hard to not be good at everything right away. And it's totally okay, because no one expects you to be. And a lot of times students will get onto the floor that first couple weeks and they feel so defeated because they're not operating at the same level as the RNs that they're working with. But nobody expects you to. I mean, you're brand new, and even once you graduate, having completed the entire program, you start out with a preceptor, one-to-one with like one patient. Nobody expects you to take a full load right away. So it's okay to be new. So you're now a new student, and when you graduate, you're going to be a new graduate. So even if you were taking 2 or 3 patients as a student, you're going to go back to 1 as a graduate. So we're planning to learn, and we're planning to grow. We take classes, we participate in the education, and we experience these gains while we're following this prescribed path. So we're thinking like, wow, this is really linear, right? So thinking about Lewin. But at the same time, there's a lot of underlying chaos. So you can't control the patients, you can't control their diseases, you can't control the environment, you can't control life. So you can't control all the extraneous things that are happening, like, births and deaths and illness and relationships and finances and, oil furnaces and car tires and all those other things. So there will be chaos. So even despite all of your perfect planning, there will be chaos. It's okay. I've got your back. Your classmates have your back. We're all going to work together. We're all going to move forward. Don't get too hung up in the minutia. We can make this work. So thinking about unplanned change, because it happens, let's talk about the chaos theory. So sometimes things appear to be orderly, but in fact they're very chaotic. So from an outside view, you may have worked at a facility or an office or something where from an outside view, things looked organized, but from a working standpoint, things felt very disorganized or chaotic. Conversely, sometimes things appear very chaotic, but in fact there's really an underlying order. And a good example of this would be like when it's really busy on the floor or in the emergency department, in the ICU, or when a patient suddenly deteriorates and you have to change your plan of care. It might initially look very chaotic while you're doing triage and treating the immediate life threats and taking care of ABCs, and people are kind of running around and everything is kind of happening at once, and they're getting blood draws and EKGs and x-rays and IVs and fluids and meds, and there's people charting and phone calls and alarms going off, and it appears chaotic, but there's an underlying rhythm to all of that. And as the nurse, you have priorities and you have a situational awareness of everything going on around you, and you can prioritize. So this is also true though at an organizational level. So it may appear very organized and it's chaotic, or it may appear very chaotic, but there's some organization underneath. And what's interesting is that eventually the chaos finds a direction to follow, whether it's a positive direction and a leader emerges, or it's a negative direction and some sort of negative leader, unofficial leader emerges, and people follow that person. So it's important to recognize that both planned and unplanned change will happen. The butterfly effect is one of the things that we talk about as part of the chaos theory. And this is kind of like the ripple effect. So they talk about the fact that it's kind of like a metaphor, like a butterfly beats its wings and then the air currents eventually become like a hurricane that wipes out an entire island, right? So dynamic environments such as nursing are highly sensitive to initial conditions. So those little changes that can have a profound effect on the final outcome. And I want you to think about this like in terms of patient vital signs. If you don't recognize subtle changes in patient vital signs early on, it can have a profound effect on the final outcome for that patient. It can even prove to be fatal if you don't recognize and intervene immediately. So I want to demonstrate to you how the chaos theory has led to some really amazing stuff. December 28th, 1978, there was a plane flight, United Flight 173, that was inbound, I think, to Chicago, if I remember correctly. And during landing, the pilot, engaged the landing gear, and one of the lights didn't turn on, and the lights turn on to signal that the landing gear are fully down and engaged. So, of course, the thought was that the landing gear were broken. So they called the tower, reported a problem. The crew worked on it. The plane circled for hours, eventually ran out of fuel and crashed, and people died. What was the underlying cause? Well, after a big investigation, they found out that it was a burnout light bulb. There was nothing wrong with the landing gear. But the reason for the crash had nothing to do with the landing gear or the light bulb. It had to do with a lack of situational awareness on the part of the pilot, the captain, and a lack of assertiveness on the part of the crew, which led to a breakdown of communication. And we can really relate this in nursing to a lack of situational awareness on behalf of the RN or the MD, and a lack of assertiveness from like the LNA or the LPN up to the RN, or the RN up to the MD, can lead to a complete breakdown in communication, which makes the responsible provider not aware of what's happening, and the patient then can end up being the plane that circles for hours, runs out of fuel, crashes, and dies. So what was the final result of this little butterfly? So the creation of what we call crew resource management. So aviation went in and they looked at what was going on, and they said, so really the problem was you guys didn't talk to each other. And had you talked to each other, it would have resolved the problem and you would have been fine. So they created a educational tool called Crew Resource Management, which empowers everyone to recognize and call out safety concerns and issues. And it enhanced both safety and communication at any level. So anyone can say, you know, wait, there's an issue, I'm concerned. In our hospital, the catchphrase is, I need clarity. So if you feel like there's a concern and the needs of the patient are not being safely addressed, if you say that phrase, I need clarity, everyone is supposed to stop doing what they're doing, stop thinking about other things, and pay attention to what it is that you're saying, because that's supposed to signify, I'm worried about the immediate life threats that I fear for my patient. So how does this impact with nursing and medicine? Well, because of continued lack of situational awareness and communication problems in medicine, just like we're talking about here, a couple of physicians started researching how can we improve communication, and based on Crew Resource Management, they created SBAR. So the tool that we use to communicate, and some people use SBART, it has a T at the end, but the tool that we use to communicate was actually created based on this crash and the development of Crew Resource Management. So physicians were looking for that same improvement, and now we use the SBAR tool to improve and enhance patient safety in the hospitals. Similarly, if you think about surgical errors in the OR that led to the practice of the timeout, things like that. So this one little issue way back in 1978, where only 10 people died, and I say only, I mean that's a lot, but still only 10 people died, then had this butterfly effect where eventually now the standard of care in medicine is to use this communication tool called SBAR, where we have saved probably hundreds, if not thousands, of lives annually. So that's the butterfly effect, and that's the chaos theory in action. So let's talk about the human response to change. Stress. Even planned change causes stress. And there's two types of stress. There's eustress, which is good stress, and eustress makes us very happy. And there's distress, which is bad stress, and distress makes us very sad or angry. Eustress is short and beneficial. It enhances both physical and mental function. It's basically a quick dose of epinephrine and norepinephrine into your system that enhances your ability to focus. It increases situational awareness, and it makes you better at like test taking, things like that. But this is very mild, short-term stress. Distress is bad stress, and this is long-term or severe distress that leads to then chronic problems like anxiety, depression, obesity, fibromyalgia, diabetes, Cushing's syndrome, things like that, where you have they have even linked cancers and other health problems to chronic stress. So it disrupts homeostasis and health. So it's normal for some resistance to occur to change because change is scary, and we know that it causes stress. Even change that we really want to occur, like going back to school, can seem overwhelming because there's a lot of work and effort and time and cost that you're incurring in order to make this change. So sometimes other people or forces are going to be barriers because they're jealous, or they don't share your vision, they're competing with you, or they're just unhappy about their current situation, but so far their dissatisfaction, vision, and first steps have not overcome their own personal resistance, so they're just going to get in the way of your success. So think about that. Are you your own worst enemy when it comes to successful change? Like, do you sabotage yourself? Are you procrastinating? Are you not doing what needs to get done in order to be able to successfully navigate change? How can you embrace change? Right? What can you do to really have a good, strong vision of the future? And what can you do to make sure that you're taking those first steps to be successful? And what is it that's holding you back, and how can you let go of it? Long-term distress can be very harmful. So we talk about the general adaptation system and the effects on the body. So initially, the fight or flight response is activated, and it allows us to, run away or protect ourselves. And then we go into this, so that's the alarm phase. Then we go into this resistance phase where the body has an enhanced coping mechanism, and you kind of adapt to the environment, and you have an elevated resistance. And then your body gets depleted or exhausted, and everything starts to break down, and you start to become ill. So another way to look at it is this graph, where you have the alarm phase here, where a stressor occurs, and this blue line is homeostasis. The body initially responds with epinephrine and norepinephrine, so that fight or flight response, where you have then a susceptible phase where you could get sick. And then you have the resistance phase, where you have an enhanced immune system for a little while, and you're able to push through things. And so, this is the phase where people say, I don't know how you do it all. I don't know how you keep going. And you think to yourself, because if I stop, I'm going to die. And, that's a joke, but probably not so much. And then exhaustion phase occurs when you've depleted all of your resources and you kind of crash and burn. And a lot of times people will say, I don't understand what happened. I get sick every time we go on vacation. And why is that? Because you stopped having that stressor, and your body is just exhausted, and so your immune system drops, and you drop below the line, and you're vulnerable to illness and disease. So to minimize stress, it's important to become an effective change agent. And so what I really want you to think about is, how can you become better at effectively promoting change? In your book on 428, there's keys to survival during transition. So it talks about how to survive. I think this is super important during the first couple of weeks of class as well. Just because we're all super stressed about all of the change. So it starts on 428, it's continued on 429. There's like 9 key points to cope with stress at work, but it's true for stress at school, at home, and everything as well. How can you promote change? So think about that as well. Like, how can you be an effective change agent? What are some things that you could do you think, after reading this chapter, to effectively promote change? And how can you face change with enthusiasm for personal growth? And again, my best advice is keep your eye on that long game, or that goal, and not short term. So come to class prepared to discuss barriers to change, catalysts of change, and methods we can use to facilitate change. I'm really interested to hear your own personal experiences and the ideas that you have, and see what we can come up with as a group as to how we can be change agents effectively for ourselves and within organizations.